We're joined this morning by Dr. Alexs Billioux. I'm going to mess your name up. I know that.
That was perfect.
Was it perfect? Okay, good. What is your official title? Are you Deputy Secretary of the Department of Health?
No, so I'm the Assistant Secretary, and I lead the Office of Public Health.
Okay, gotcha. We got to talk COVID-19 moving into phase 2. We make the move to phase 2 because things have improved. Is that the obvious conclusion?
Yeah, things continue to improve, certainly statewide. I think we highlighted yesterday in our press conference and information we've shared since then that, certainly it's not the same across the entire state, but in general, we're seeing fewer cases reported. We're seeing fewer hospitalizations, importantly, and so things are improving.
What are you looking for as we move to phase 2? What are some of the things you're watching out for to know that we're having another wave?
Well, we're going to be watching a couple of key measures. One is, the number of people who are showing up to emergency departments with symptoms of COVID. So people who are having fever and cough, shortness of breath. We also know that COVID can cause some weird symptoms like an upset stomach sometimes, or loss of smell or taste. And so as people present with those symptoms to the emergency department, we'll see an early signal that people may be getting sick. We've been working really hard across the month to get a lot more testing across the state, and especially into our rural communities. And we're watching to see the number of people who are diagnosed with COVID. And then certainly, because healthcare and access to healthcare is such an important aspect of helping people get through, especially severe COVID, we watch hospitalizations and checking on what is the number of people currently admitted in the hospital in the state for COVID-related illnesses.
Dr. Billioux, there are a lot of people that are listening to you this morning that are scared, that are worried about getting out among the public. What is your message to them today?
Well, so I think, it's understandable. We've all gone through something, as a society where we all just did something very abnormal and stayed home for, months, really out of concern for this virus that while most of us, if we get it, will do okay, we know it's killed far too many Louisianans. So I understand that concern. Though I think it can be really channeled into being productive, just keeping it at front of mind, still getting out, doing things outdoors where you're actually, relatively safe because of the airflow, and as long as you're keeping distant from people. And then the other thing is, even if you're going to go indoors, wearing a mask, outdoors or indoors, if you're around people that are not in your immediate household, wearing that cloth face covering and encouraging others to wear cloth face coverings around you means that if you're shedding the virus and not aware of it, or if they're shedding the virus and not aware of it, it really reduces the likelihood that you'll get infected. And we've been giving out guidance to businesses and various sectors in phase 1. We're updating that guidance now in phase 2 to try to give these places that we go to as much information as possible about how to reduce the risk of having that trip to the restaurant, that trip to the store, be something that risks you developing COVID. But the last point that I would make, importantly, is if you're in one of those groups that is really high risk for doing poorly with COVID, that's people who are older than 65, have significant heart disease or diabetes, kidney disease, severe obesity, or your immune system doesn't work normally. Those people really should remain home, if at all possible right now, while there's still a fair bit of COVID in the state. Having other people deliver your groceries or go get your medications for you if you can. If not, make those trips short and wear a mask. And if you live with people like that, you need to be mindful of your trips out as well, because we don't want you to transmit it back home.
Gotcha.
Antibody testing, how is that playing into the state's measurement moving forward through phase 2 and towards phase 3?
So we don't really have a gating criterion related to antibody testing. So we're really looking at active cases and monitoring those and symptoms and hospitalizations, as I mentioned earlier. That being said, we are very interested in what we can learn from antibody testing. We know that there are a couple of studies already going on across the state. We know that LSU Shreveport is looking at conducting a similar study up there, and so we are interested to see what that can tell us about the proportion of the public that may have been exposed in the past to the virus, and what that's going to be most important to tell us is how quickly did this spread, and also a little bit about how long is it before we start to see signals of widespread antibodies, and if those antibodies do protect you, if they do give you immunity, how close are we to this concept of herd immunity, the idea that there's enough people out there who have had it before and we don't think they can get reinfected, at least in the near term. And so that means that some of these restrictions and going back to more life before COVID becomes more possible.
So does this create a balancing act as we look at the grading criteria? Because we know that this isn't just going to go away overnight. It's not going to disappear. So our cases will continue to go up. If the cases go up substantially, but the hospitalizations don't move and ventilator use doesn't move, but the cases go up, is this like a balancing act where, yeah, we've seen a big increase in cases, but people aren't going to the hospital, so we can still move forward? Or is that a big spread of cases is still going to prevent us from moving forward, even if the hospitals are still relatively empty?
No, we have to look at those cases in context. I mean, this past month we've had a fairly steady level of cases in the 300 to 400 range. Sometimes higher, sometimes less. Sometimes it appeared higher when we were bringing in old labs that hadn't been reported to us previously. But on average, part of that is driven by the fact that we've doubled the amount of testing statewide from where we were in April. We've essentially doubled what the White House has given us as a goal for testing. And so as you test more, you're going to find more cases. So just in isolation, seeing more cases, not enough for us to feel, that things are getting out of hand. As you said, we really want to see what's going on with hospitalizations, what's the severity of the illness, and also what's the rate of rise in those cases. What we've been seeing is a pretty steady flow, driven by the fact that we're testing in nursing homes, and those high-risk populations. We're testing in other settings where people are living closely together. As we do that, we're going to find cases and asymptomatic cases, people who don't have those symptoms of COVID, but who we want to be able to move out of being engaged with the public so that they're not contributing to spread.
Back to that old data that you kind of touched on a little bit, we've seen a couple of spikes where we get hundreds of cases that date back to March being posted in a single day. How does that happen? I mean, it sounds on the surface like that's not good for this type of scenario. So how does that exactly play out?
Well, part of it is because of the way that we've actually been able to increase testing so dramatically. I mean, I think when you think about just how much we've been able to do for COVID between the beginning of March and now, the end of May, now beginning of June, one of the ways we were able to increase testing so dramatically was to work with laboratories that had the machines that could process tests, but didn't have, maybe they were research labs or groups that just bought tests for the first time, or new lab tests that can even be run in your doctor's office. Those are people who are not used to reporting to the state electronically. So if you were previously a research lab at LSU Shreveport and suddenly we're saying you need to behave like a clinical lab and report to us, there's a lot of work that's involved in making sure that information can get to us. And so our team's been working with those labs across the state. It's not the kind of thing that happens very quickly, especially if that lab is spending most of its time trying to process tests. And so that's the reason that occasionally we'll have these labs that when we finally get them connected to our system and all that data comes over, that's when you see those spikes. The thing that we can assure the public is those labs have been giving those results on a daily basis back to the providers who were ordering the tests, and so those tests would have been those answers would have already been conveyed to people around the state. So it's really just that the state did not yet have those results in hand. But people already knew their status. They'd already been informed by their provider.
Talking to Dr. Alexs, Billioux, the State Health Department. Let me ask you this. I get a little confused because the goalpost seems to get moved. It doesn't spread on surfaces. The World Health Organization says only wear a mask if you're around a person with the disease. What am I to believe? You follow me?
Yeah, no, I mean, and I'm not sure. I mean, I hear you're saying it as the goalpost is moved. The thing that I would point out is, again, we're 5 months into knowing about this virus, and so there is just a ton that we are learning, literally every day. There's the entire globe focused on trying to learn as much as they can about SARS-CoV-2, the virus that causes COVID. And as we learn that, we have to adapt, right? We want to make sure that if there's a new piece of information that comes to us about a way to better protect the public, we act on it. And so I think one of the things we most recently learned was that, we had feared that one of the big major transmissions, kind of like flu, is that as people cough or sneeze, these big droplets come out of your mouth and land on objects, and that you touching those objects like a doorknob or something like that, and touching your face is a major way that you would get infected. And that is still a way that we think you can be infected with the virus. What we've most recently found, though, is there's more and more data to show that it's really a smaller droplet that comes out when you breathe, sing, or cough or sneeze. Those particles that are smaller and stay in the air longer, what we call aerosols, those seem to have a bigger contribution, make a bigger contribution to the spread of SARS-CoV-2. And so that makes a big difference if we're going to advise, mostly hand washing and cleaning surfaces versus really needing to wear the mask as a way to protect others from you and them to wear a mask to protect themselves or to protect you. And so that's, as we learn that advice, we have to adapt to it. And that's why you see our guidance change.
Let me ask you a personal question. You may not want to answer this. What does Dr. Alexs Billioux get up in the morning every day and take as a precaution for COVID-19? What are you doing?
I don't take anything. Fortunately, I'm fortunate to not have to take any medications. What I do is take my mask with me, and not because that's going to protect me again from getting the virus, but it's going to ensure that if I'm one of those people who is asymptomatically or is asymptomatic and at risk of spreading, that I'm protecting others. I also take precautions. I wash my hands, though I do travel up to Baton Rouge and I'm in meetings mostly by phone, but occasionally with others in the room. I take precautions. I try to stay 6 feet away from people. I wash my hands frequently. I don't touch my face. If I'm going to touch my face, I wash my hands before and after. So I take all of those steps to really reduce the risk, both not only for me, but also for my family.
But no vitamin D, C, or zinc, or, we've heard all kinds of things we should be doing. You're not advising that.
And vitamin D, C, and zinc are good for you. They're not going to be, problematic. But what we don't have is evidence that they specifically are going to reduce your risk of SARS-CoV-2 specifically or developing COVID specifically. So not a bad thing to do those, but I think we just don't have evidence right now that they're going to make a big difference. And so I think, for that, plus, medications that we're hearing about that are being tested out, there's just so much information that we're trying to gather as quickly as possible. And that's frustrating, I think, for the public who feel like 5 years is forever to not have answers to some of these things. But in perspective, for the medical community, knowing as much as we do already and having as many tools in the toolkit, if you will, already are pretty phenomenal. And that makes me hopeful for the future, for what could happen in the fall, even before we have a vaccine, maybe having more medications like remdesivir, the recently approved medication. That all makes me hopeful that really the entire world is focused on trying to really prevent and eliminate this virus.
And with the vaccine, we know that vaccines are never promised. So you did bring up remdesivir. LSU Health Shreveport has been reporting great work with nitric oxide. If we don't get a vaccine, if it's not possible, but we come up with treatments, will there be a point in the future where even vaccineless, with treatments, we will be able to move back towards what life was like before COVID-19?
Yeah, so it's hard to say definitively, but I certainly think that that's reasonable. There's a number of things that can change. The virus itself can change and become milder, and medications are a big factor that could change. If we knew that we could essentially, even if somebody was severely ill, have a medication that would turn their illness into a much milder illness. If you think about the flu, we have a vaccine, but we also have medications we can give that shorten the duration and lessen the severity of flu. It just changes the equation. It means that you're a little bit more comfortable with people potentially getting infected because there's something we can do about it. I think early days where we knew that there was very little we could do and we were seeing really high rates of death, that was a very different equation. So I am hopeful that all of these efforts that we're making will allow us to really change what we're doing in the future and continue to engage more of the economy and more of normal life. slowly but steadily would be my preference.
Dr. Alexs Billioux, Office of Public Health, thank you for your time today.
Thank you.